This is a demonstration of how I would create a new patient health record. First, we will take this patient information form and complete it with all the patient's information needed, such as last name, first name, address, and other information. The correct labeling of form is very important to correctly identify the patient. After that, we will use a blank cover folder like this one to retain the patient's paperwork and documents. As we usually mark it with patient's last name and the year of the record, we will now be able to retrieve the patient's first three letters of last name, which are KAU, because the last name is Kaur. Labeling is important as labeling makes it simple to keep and locate patient's record in storage area. As these files have markings on them to help you put the labels in order, we will follow a pattern while labeling. The three letters of the patient's last name will be positioned as follows on top. We shall label the file's year at the bottom. The year label corresponds to the year of the most recent entry in the patient's file. Also, we'll make sure the labeling is placed in right order. Maintaining the symmetry of the files in the rack and making sure labels are placed correctly can make the files look more organized. We will write patient's name here in the middle portion. First, we will write the last name, comma, first name. There is a label of name alert like this. It is used when the last name of two patients is the same. Then we will put this label on the file like this to alert the employers to look for the correct patient's file. We will now print the document we need to include in the patient's file, including the progress note, medication list, and patient history questionnaire. Each form needs to be properly labeled with the data from the registration form. Now we will flip the file and file all the documents together. As per the organization's policy, the progress note is placed on the right side of the file. When organizing the patient's document, a MOA should refer to the clinic's policies. On left side of the file are the history questionnaire, medicine list, and registration form. Other documents such as invoices, receipts, consents, and information requests would go on the left side of the file, while laboratory diagnostic reports, consultation reports, requisitions, and referral letters would go on the right side. We shall now secure it by clipping it together. To make it simple to find, we will place this file in the racks facing the label side out.